Great. Thank you so much, Governor. And thanks to all Alaskans for tuning in and staying up to date with what's happening across our state. So on the first slide, same sort of dashboard that we've had before. So 92 new Alaska cases today. Just a few more details on that for people's awareness. So we had a previous total of 2,041. One case was removed from that because it was an Anchorage case that upon further evaluation turns out to be an out-of-state case, and so was moved into that. Plus the 92 new cases today for a total of 2,132. For our out-of-state cases, we had a previous total of 484. We had 2 new cases today, and then that one that I mentioned that got moved from the Anchorage in-state to the out-of-state for a total of 487. So those are cases, they're broad and kind of around the state. So 40 in the Anchorage region, 11 in the Valdez-Cordova census, 7 in the Juneau area, 1 Barrow, 7 Fairbanks, 6 Wasilla. There's a bunch more details, 2 Palmer, 1 Seward, 1 North Pole, 2 Sitka, and they are in our press release, which we will make sure that everyone is able to see. And you can also sign up for those if you would like to get them emailed or texted to you on a regular basis. To the one friends and family who has lost someone from COVID, we are thinking about you during this time. And as we're seeing increasing cases, it's always, we think about every life that has been lost from COVID or otherwise. 4 new hospitalizations as of today. We have 28 people in the state of Alaska that are in the hospital. We have 3 people in the ICU. 1 person is on a vent. 8 people are still persons under investigation, so who the clinicians think have COVID, but they're waiting for tests to come back. We have a total percent positive rate at 3.01% positives, and our total cumulative tests, as the governor mentioned, 185,000, just over that in the state. So appreciate everyone's time and work on that. Moving to the next slide, this is kind of a little bit of a busy slide, hard to read, but we've been sharing with you kind of the green, yellow, and red matrix that we've been looking at when we've been looking at our dashboard. This just has some more detail on it. So when we're thinking about the epidemiology, we're talking about the number of cases, what our R0 value is, how many outbreaks we have, how many discrete outbreaks we have. Are we seeing a resurgence of cases and our percent positive going up? And really for most of those things, we're in the orange zone right now. The one area that's in the green zone is what we call symptomatic symptom surveillance data. And that's looking at people in the ICU hospital who have COVID-like symptoms. And we haven't seen any uptake in that recently, but we continue to watch that surveillance data. For healthcare capacity, we're for the most part in the green. The one part that has moved to the orange is the Anchorage Icu Bed Capacity. So when we look at the bed capacity on the state dashboard, that's all the beds in the states. That's inpatient and ICU beds. That includes ICU beds such as neonatal care ICU beds or NICU beds, as well as pediatric beds, adult beds, and they are in all sorts of locations. We want to make sure that we're tracking numerous regions, and particularly because so much of the healthcare is focused in the Anchorage area, we want to keep a close eye on those numbers and beds as well. And so the Anchorage ICU bed capacity is the one that's in that orange level. And then with the public health capacity, those are the 2 things that we've talked about in the past with testing as well as contact tracing. So for testing, we still have broad testing. The area that's moved into the orange for the testing is the turnaround. So there have been some delays and some shortages in reagents. We're also seeing commercial labs across the country becoming more overwhelmed with increasing cases around the country. So we've seen some increasing delays there. I know for many Alaskans, this can be really frustrating to have to wait for your lab for many days. We're doing everything we possibly can to speed that up and get tests back out to people as quickly as possible. There's a lot of factors for that, but continuing to move along that, but that is in the orange. The contact tracing, part orange, part red on that one. So in general, we are continuing to contact trace every person. People still have quite a few contacts when we're contacting them, but it is taking longer for us to contact people once we find out they're positive. So what we do is we are now prioritizing those who are at our long-term care facility, those who are at higher risk, and contacting them. We are still having providers calling the patients initially and contacting them to make sure that they know that they're positive, but the contact tracing part can take a bit longer. And the more that Alaskans can keep track of a log of those that they've been in contact with, the easier it is, the faster it is. And then most importantly, keeping those circles really small and those bubbles small. Again, if you cannot name all the people that you've seen in the last week, your bubble's too big. So this is the time to pull back. Moving on to the next slide, this is just a slide of our trending hospitalizations. As you can see, this is the total number of people in the hospital, and that has kind of trended slowly up. And we'll see a lot of variability with that, given age and where we see outbreaks, and continue to follow that closely. Moving on to the next slide, this is the data based on age. And so you can really see that kind of orange graph in there, that 20s to 30s range, That is our biggest group of people that we're seeing contracting COVID here recently and presenting. I will say that when we've looked back at our data, 18.8% of the people who have been tested positive for COVID have been asymptomatic, while 81.2% have been symptomatic. So most of these people are symptomatic who are getting tested and testing positive for COVID. You can see the next age group is that kind of 30s to 40s, and then 40s to 50s is the next kind of age group along there. We're starting to see a pickup in the younger cases as well and continue to follow those closely. There's a similar trend to what we've seen in the lower 48. One other note about testing as well as cases, each case is an individual person, and that individual person, if they receive multiple tests that are positive, they're only counted once. That's only one person that we count. However, the test is the total tests that were done over the total tests that were positive over the total tests that were done. And so I just want people to know about what we do there. Moving on to the next slide, I want just to make sure that people know that we have a website up with a bunch of information about fabric face coverings and masks and the science behind it. I'm really grateful for our EPI team on the line today to be able to share some additional information. We've had a couple significant outbreaks, and there's some details here. I'm happy to answer questions about them later in combination with our team, but we continue to follow these outbreaks quite closely in the seafood industry right now. Moving on to the last slide, just a couple highlights. We do a weekly summary that you can sign up for and have those sent to you. So again, that's where I share that 18.8% were asymptomatic and 81.2% were symptomatic of the people that we were able to look at. Alaskans do appear to be acquiring the virus from many types of gatherings, social gatherings. They might be in people's houses, barbecues, backyards, camps, churches, funerals, sporting events. We've seen a whole variety of places that people are contracting COVID. Community transmission is occurring in almost every business type or every interaction that involves in-person to in-person interaction. And that's why that 6 feet apart, mask, hand washing makes such a difference no matter if you're at work or not. Most non-resident cases that have been identified have not had significant community interaction. They've been in quarantine or part of a working industry group. And with the current rates that we have right now, we really will continue to see an increased climb if we don't do more with physical distancing, kind of face coverings. And so we're really asking Alaskans to pull back your bubbles, which is the next one, shrink those bubbles a little bit, hand wash, wearing those masks when you're in public to minimize the spread in case you might have COVID and don't know that you do. And you may be pre-symptomatic or asymptomatic and want to protect our community and protect each other. So with the last slide, continue to send us your questions. Appreciate everyone tuning into the Science Echo today. We have the Healthcare Echo tomorrow. Been doing echoes for healthcare for teachers and healthcare providers across the state, where you get to hear from the team. And with that, I'll hand it back over.
Thanks, Dr. Zink.